It's 9 o'clock actually, with a little bit of seconds on the right side. You got your doc in the house. It's raining out there, and I want to suit you in bed, and wherever you are. I know most people would be in the car or in the house. Listen to the doc. We're here today for half an hour. A full pack program for you, and I'll be right back. So, here we are on Saturday morning, 9:02, and we're dealing with, well, last time, a couple of weeks ago, we talked about women's health, and we need you. You imagine this world with all men? Would be one dysfunctional world, actually. So we need you, ladies, and we want to thank you for being here. Wives, sisters, brothers, partners. We thank you, because without you, in our extremes of emotion, whether we're happy or whether we're sad, or we're not, we're somewhere in between, we do need you. Your comfort to the soul, you know. So after God, it's you. You remember, that's how it started years ago. The Lord see that we couldn't do it by ourselves. But, you know, we also got to talk about men. So we spoke about, just a recap, and breast cancer and all of those things. We said you should do your breast exam from the time you start to have your menses, whether it's 11, whether it's 12, whether it's 13. Yeah, so, you after your periods, just do a breast exam and let your GP show you how it's done, so you can know what normal is. So when you feel an abnormal lump or so, or something abnormal, you can consult therapy and get therapy very early. Remember, you always be one step ahead in everything in life, not only in health. Always try to stay ahead of whatever will come your way, and you'll always, most times, you'll come out the winner. We catch cancers very early. We can add and extend your life significantly. Catch it before it gets out of the tissue itself. Whether it's in the breast tissue, take the breast out, and then you got, don't wait until it gets to the lung. And you young ladies, I said to you, yes, I know cosmetics and so forth, how we men, sometimes we drive you to do things that you really shouldn't do. In other words, you feel that if you don't have your breasts, we wouldn't like you as much. And we're the one that really perpetuate that. But, you know, in this new technology, so many things can be done to improve that. But the lump, I just don't believe in the lump, and that's only my personal opinion. I don't believe in a lumpectomy, taking the lump out and leaving the rest of the breast in there, and then next thing you know, 3 years down the road, you got cancer all over your body, and then it's the end of the road. No. Take it out. Just take it out. And, you know, you can do other things. But when you love someone, you should go beyond the physical. And love starts from within. Whenever you see you love someone and it's physical, it doesn't last. You have to know that person from deep down in there. So let's go. Men's health. We talked about cardiovascular disease. This is number one. And I don't want to be here and talk about heart all the time. And by the way, this heart you'll see soon coming up live. Rarely men do that. We did one of the most difficult angioplasty this week on someone with a heart completely blocked artery, and open that on live camera. People don't do that. Normally doctors would just show you, take the tape and give it to the news. We brought the news in. So it'd be nice to see that. I think our young children should see things like that so they can know, because they're the people of tomorrow. And they need to see that not only people of different color can do these things, people that look like them can do these things, and, motivate them to be surgeons and presidents and so forth. So we, as the older ones, needs to make way for the younger ones, and that's what it's all about. So stay tuned. You'll see that on television sometime very, very, very shortly. And in reference to other things, all the controversy and stuff like that, don't even worry. The truth always will prevail. You hear? And you see me, I always tell my friends, as a matter of fact, I have first God to answer to, then I have 6 children to answer to, then I have my patients, then I have my employees, then I have my followers, then I have my friends and fans. All of these thousands of people, trust me, this stuff, when you elevate yourself to this level, you live very, very, very circumspect, and in truth, because you have people relying on you. That's why I run, and my heart got to keep healthy anyway, so that I can keep yours healthy. So I run and I sleep a lot. Make sure you get 6 to 8 hours of sleeping. Drink a lot of water, and exercise. Eat healthy. Stay away from a lot of red meat and so forth. Those are some of the things. And you take a little drink now and then, but moderation. And then the smoking and stuff, stay away from that. Not good for you. But cardiovascular disease is the #1 cause of death in the world. Whether it's stroke or heart attack, that affects men more than females. So we're going to talk a little about men's health today. And but I gotta tell you something. The punchline is that women, when they get heart disease, it's more deadly and they die faster. So the mortality in women is higher, but we get more heart attacks and stroke and so forth. So we'll talk a little about that. And I want to play some nice songs for you in bed there with your lover. I gotta give you nothing else but soothing to your soul, because life is not only about work and all of these things. Life about everything, even laying between the sheets and thinking and saying to your partner, I love you. So Otis Redding this morning, how strong my love is. Yeah, that was Otis, how strong my love is. And we're going bit by bit down. I'm going to move down from the heart, somewhere around 1.5 feet downwards to the prostate. How about that? But some people are short, it might be 1 foot, and some people long might be almost 2. Don't matter about it, but you know what I'm talking about. We're going downwards, we're going down. Well, this is south. Yes, we talk about coronary artery disease and so forth, a lot of that happening, but what about the prostate, guys? Let's do some anatomy first. You understand what a prostate is? It's just underneath the bladder where you have your urine, and then out of it, it produces this fluid that bathes the sperm. There's something called the testes or testicle that emits the sperms. It comes up along the seminal vesicles, and the sperm comes out there, but then the prostate itself produces the fluid for the sperm to bathe in, and then it comes through the urethra, which is a tube coming out from the bladder, but it goes through the prostate and comes out through the penis, and that's where the urine comes out, right? It's the size of like a, is like a nut, actually, when you're growing up, So, but what happens is you get older, it gets larger, it grows with age. But it's a good thing, as I always say, to know your family history. But we'll talk about the family history later. But that's anatomy of the prostate. Fluid comes from the prostate, gives the sperm something to move in, and that's ejaculate and so forth. You're growing up, you don't have a problem, but then as you get older, you start to, as that prostate get enlarged, you'll see it encroaching or closing down on that urethra, and sometimes you could have symptoms. So if you've got difficulty passing urine, or sometimes you go to the bathroom and you're leaking, you're dribbling. I mean, you stream, stopping, and then starting again, or you see a divided stream, or sometimes even after you finish urinating, you feel like some drops are still coming out. How about if sometimes you might even feel like you finish urinating, but you feel like your bladder is still full, that type of thing. And then you might even get up too often, you're getting up very often to urinate and stuff. Those might be signs that your prostate is enlarged, or they may be cancer, we don't know. So we will know, and we'll talk about these things. Listen to those things I talk about, symptoms of urination in men. And we'll come back and talk to you about prostate and how we deal with this stuff. It's all about knowledge for you, baby. Right here, VOB 92.9. Every Saturday morning, 9 to 9:30, your doc, right in the house now, with the fifth dimension. Great love, ashes to ashes, love coming all the way from VOB to you in your bed this morning, and I'll be right back. Yeah, that was ashes to ashes. So, I know your lover is still there with you, so it's just the melody that gets me. I like that type of songs and the way they construct the music and so forth, Music is everything. It's food apart from the physical food you eat, I mean, the music, as a matter of fact, if you love music and you laugh a lot and you kind of make yourself happy, even in this very stressful world, you live longer. So it's not living, longevity has not only to do with one thing, genes. Got to do with all these type of things? Sit down and just give yourself a break and listen to some music. Relax in the chair and let the music just flow in your body. You're surprised to see how it can bring that pressure down. So we talk about those symptoms of prostate. Sometimes it can be a nuisance, and there's something called benign prostatic hypertrophy, which really has to do with an enlarged prostate. And it can be no cancer there. A lot of times the doctors can just go in there, and if it's enlarged, we do a rectal exam. And don't forget, guys, I talk always, and I always speak about family history. Every one of you today listening to me in Radio Land, whether you're here or overseas, you should know your family history. I keep saying that. Find out how mommy, daddy, brother, sisters, uncle, and all your close first-degree relatives would have passed or leave this world. Because odds are you'll leave that same way, except you may prolong it if you do some lifestyle modification. But you have to know what takes the family out, because we all have that genetic composition when we are born. So, and especially siblings, if your brother has had a heart attack or prostate cancer, you know the likelihood is increased at least 10-fold times compared to the normal population. So if it's enlarged and you're starting to have these symptoms I mentioned before, what you should do is consult your GP and don't stay away from the digital exam. The rectal exam is extremely important. We can feel there and see if the prostate is enlarged through your rectum, and we can also feel if there are nodules or hard, rocky surfaces which may be consistent, or nodular surfaces which may be consistent with prostate cancer. You see that early, take the prostate out, and you go on a normal lifespan. It's important, guys. So when you get to 40 and stuff like that, and if you have prostate cancer at an early age in your sibling, try to do it earlier. Get that rectal exam, get the doctor to do it, and if he is uncomfortable with doing it, go and get it done by a urologist or so forth. Most times over 70 people would have prostate cancer at that age, and sometimes it's not something you treat. You're over 70, most times it's not very, very aggressive. When you're younger, 40s and 50s, and you got prostate cancer, it's very aggressive. And the stage may be very, very, very high, so you would need to have aggressive therapy. So it's important to have this something called PSA, prostatic surface antigen. You hear about them, but you have to concomitantly have it done with the rectal exam, and the doctor can make an assumption what type of entity you have. So after heart disease, prostatic cancer is extremely common in men. Guys, let's live and do the right thing. I'll be right back, and I come back, we talk a little about testicular health, and then let me give you something different here. We did a little bit of Otis No One, Alicia Keys, and then I'll be right back. Yeah, that's Alicia Keys and No One. I love that song. You feel it? You feel me right there to that song. Testicular cancer, not very common. Between age 15 and 45, mostly. It's normally a painless lump in your testes or your scrotum or your, people will say the layman term, it's not a bad word, it's balls. You feel a little bit of lump in there, it's not painful. Get in touch with your doctor. Normally occurs in young people. Let's go to the things that you guys were waiting for. Men's health. Everybody thinks about men's health. Erectile dysfunction, right? Yeah, I think the women win in the end because we start to fall off. Some people at 30s, 40s, 50s, right? Yes, guys, all kind of stuff can cause erectile dysfunction, which is an inability to, perform satisfactory sexual intercourse, which is important in life. People shy away from these things. And you parents out there, sit down with your children and educate them when they're of age about these things. Don't wait for the people, their peers, to tell them. They'll tell them the wrong thing. Or their friends, or their co-workers to tell them about this stuff. You sit down and tell them about it so they can learn from someone who loves and cares. Don't be shy. Long ago, these are issues that our teenagers, we don't want to talk to them about it. Sit down and let them know. And, you can learn the stuff in the net and all that stuff. Let them know what is important, what is not important, and those type of things. In any case, I think that kids should not have sex in teenage years still after they're adults, 18 or plus. And even then, be very careful and get advice before you get involved in those type of things, because sometimes it can really distract you from your whatever you're doing in life. Conditions that narrow your blood vessels, diabetes, high blood pressure, and high cholesterol can cause constriction of blood flow to the penis, and that can cause sexual dysfunction. If you had surgery done, it can cut blood vessels and nerves, and special prostatic, whether the radical prostatectomy and so forth, can cause sexual dysfunction. And certain medicines, including antidepressants and medicines you take for high blood pressure. Very important, guys. Tenormin, those beta blockers, calcium channel blockers. That is why I say to you, and listen to me today, there's something called Diavan, or Micardis, or Atacan. These receptor blockers, they're extremely good at increasing blood flow to the penis and increasing your sexual function, and they do not cause erectile dysfunction. A lot of drugs, as I said, Hytrin and all these things, can cause erectile dysfunction and really cause your life to be not as satisfying. So you talk to your GP and let him direct you. But Diaphan, remember that name, okay? Very good to bring your pressure. As a matter of fact, it serves two things at the same time. Kill two birds with the same stone. Increase the blood flow and improve your sex life, and also bring your pressure down. So, and then you could have some psychological problems like anxiety and depression itself can cause you to have sexual dysfunction, tiredness, illness, any type of illness and stress. You can find it when you're sick and you got the flu. You don't feel like doing it, right? Yeah, all of those things. It affects. Blood flow is going elsewhere instead of down there. And smoking and drinking too much alcohol can cause that. Erectile dysfunction itself. But I'm more concerned about the blood pressure medicines, all right? Be careful when you've been diagnosed with blood pressure problems. Make sure you look it up and see what are some of the side effects, all right? Because when you start to have erectile dysfunction, I know a lot of people stop taking their medicines, and then, yes, you're able to perform better, but then you get a stroke, and then what happened? Double-edged sword, isn't it? Yes, guys, so we talked about prostate cancer. Get your rectal exam and get your PSA done. We talked about testicular cancer, which is very, very uncommon. And then we talked a little about erectile dysfunction and drugs that you can use that are used good for high blood pressure. Now, with females, the tenormin and the calcium channel blockers and Hytrin and all of those type of Coreg and all those drugs that you can use to bring pressure down wouldn't affect them. They don't need to deal with the things we have to deal with. But for men, Micardis, Diavan, and things like Atacan, good for you. I like Diavan because it's on the formulary and it's cheap. And Micardis, Atacan, you have to pay for it. So you could always switch, because right now everything about what you do with your money is important. You know, we're going through severe crisis. So guys, don't. It's like my little daughter, Ashley, good morning, and Anna, how you guys doing out there? Ashley, 6 years old, said, Daddy, you know what? You need to get the things that you need and not the things that you want. I stopped and I looked at her and says, what you talking about? I was an adult when I found out there's a difference between need and wants. I says, Ashley, what do you mean? What's the difference between need and want? She said, well, listen. You take what I tell you. The things that you want, you don't necessarily need them. The things you need them. So separate the two. That's just where you get that from, Ash. I got it from in the brain. Right there, Daddy. It's just working up there. One smart kid. God bless her. Guys, I love you. I care for you. I miss you. Every time I don't come on the show, when I'm traveling or so forth, I think of you. I tune in wherever I am, because this is important to me and you. And keep following with us so we can live forever. That's the plan. And I'm going to close off with, as a matter of fact, Jerry Washington. Right here is where you belong. Don't forget to tune in next. It's 9:29 almost. And tune in next Saturday 9 to 9:30 and tune in with the doc. We will keep you going. God bless you. And here we are, and I'll see you when I get back.